Hello, everyone. Thank you for joining us at the 2022 Annual Women's Healthcare Conference. We're thrilled that you're here to reunite with our community, celebrate how we have persevered through this incredibly challenging time in healthcare, and renew our knowledge and commitment to this rewarding profession. And that's really what the Inspiration Awards are all about, celebrating our women's and gender-related healthcare providers. Whether you're working in policy, practice, education, or research, you are making a significant difference. Dr. Rewa Thompson is a women's health nurse practitioner and the chair of the undergraduate nursing department at Stony Brook University. In her classroom, she adapts to her students' needs to support their success. In her third semester of teaching, Dr. Thompson took on a notoriously challenging class, maternal newborn health, and restructured it for team-based learning, which helps students navigate this important subject with confidence. Through collaboration with other faculty and intensive planning, she introduced case-based learning to reinforce the concepts students were struggling with. Feedback from both students and clinical faculty has been inspiring. Congratulations, Dr. Thompson, on receiving the Inspiration in Women's Health Education Award.
This award means so much to me because it's the first award of my entire professional career. I appreciate my colleagues who felt that I was deserving of this honor by nominating me because of the work that I have done in academia as well as clinical practice. I'm proud that my students show and demonstrate more interest in women's health after taking a semester with me. Thank you.
Dr. Aimee Holland is a women's health expert and nurse practitioner educator based in Alabama, but her policy and advocacy work extend far beyond her state. After observing limited access to specialty gynecology procedures for rural, minority, and underserved populations, Dr. Holland developed 7 innovative teaching simulation programs to build clinicians' skill and expand access. Her contributions to practice guidelines, position statements, and white papers have been utilized by thousands of clinicians and educational programs, improving care for women all over the world. Thank you, Dr. Holland, and congratulations on receiving the Inspiration in Women's Health Policy Award.
It is an honor to receive this policy award from my beloved NPWH. NPWH is my professional nursing home and will always be very special in my heart. And I'm so thankful for the 2 students who nominated me for this award. That nomination meant more to me than anything. The award itself is very special, especially since it's coming from my esteemed NPWH home. I am so thankful for the opportunity to serve you and to represent women's health. It was an honor to serve NPWH and the women's health nurse practitioner profession. I consider it very special and an honor to receive this award on behalf of each and every one of us who move policy forward each and every day.
Dr. Heidi Collins Fantasia's body of work almost speaks for itself. She has been published over 85 times and is a leading expert on human trafficking, violence against women, and sexual and reproductive health and well-being. Her research, which is informed by her practice serving marginalized communities in Massachusetts, seeks to help those who often need the most. Dr. Fantasia, thank you for your work and congratulations on receiving the Inspiration in Women's Health Research Award.
I want to express my gratitude for being selected as the winner of the Inspiration in Research Award. I have been involved with NPWH for many years, and it's an organization I truly admire. My research centers around the intersection of violence and the reproductive health of women, including physical violence, sexual violence, and human trafficking. Knowing that I was nominated by colleagues who I admire and who I have worked with is very humbling. Thank you for your recognition of my work in this research area.
Dr. Elaine Brown has worked in the Jamaica Hospital Health System in a number of roles, from licensed practical nurse to labor and delivery, working her way through her DNP to become a board-certified women's health nurse practitioner. Her colleagues note that her deep knowledge of the practice makes her an invaluable asset to the team, especially when it comes to process and practice improvement. Recently, Dr. Brown noticed a lack of compliance among postpartum diabetic patients following up on their glucose tolerance test. Coordinating with her colleagues, Dr. Brown created a bundled postpartum visit that increased compliance from 20% to 90%. Dr. Brown, thank you for your work and congratulations on your Inspiration in Women's Health Practice Award.
I'm highly honored to be this year's recipient of this noble Inspiration in Practice Award. Earlier this year, I celebrated 12 years as a board-certified women's health nurse practitioner. My transcending goal is to empower women in self-care while providing care that is second to none. I am humbled to be associated with persons who have inspired me, who have shaped my thinking, and those who have helped me to realize my profession's potential to make a difference. This award validates my intent to continue to take care of women. I truly appreciate this recognition. Thank you.
Now, I have the pleasure of announcing the Fran Legacy Award. Each year, NPWH bestows this award to a women's health nurse practitioner who has demonstrated commitment to women's health through practice, education, and advocacy. The award celebrates a women's health nurse practitioner who embodies the same lifetime dedication to women's and gender-related healthcare as one of our amazing founders, Fran Way. I'm so pleased to present this year's award to Jacki Witt.
Jacki Witt is an unsung hero. She is someone who flies under the radar, who does mighty work. She moves and she shakes, but she doesn't demand attention. She would rather move that attention to others. And to me, that's the definition of leader.
Having worked with Fran Way throughout my career at NPWH, I really see Jacki as being the embodiment of everything that Fran held dear about women's health nurse practitioners and the organization.
She represents everything this organization stands for, and she represents everything that Fran Way works so hard for us to be able to do.
I can't think of anyone more deserving of this award. You have been passionate about women's health and passionate about our profession since the day I met you. And I can't think of anyone more deserving of this award. I'm so proud to know you as both a colleague and a friend. Thank you for all that you do for women's health and all of the support you've given to women's health nurse practitioners throughout your career.
First, I'm thrilled to receive the Fran Way Legacy Award, inspired by one of our sheroes. Thank you so much to the selection committee for this recognition. Thank you to the National Association for Nurse Practitioners in Women's Health, and many thanks to my colleague and friend who nominated me. Honestly, this is the biggest honor I've ever received. It has prompted me to review some of the high points of my career, and it has clearly reminded me of all the things I love about being a WHNP. I do find it relevant and ironic to receive this award in the wake of the Supreme Court's ruling in Dobbs v. Jackson Women's Health. This odd juxtaposition caused me to reflect further on NPWH's mission, which says in part, we are committed to, and I'm roughly quoting, promoting and protecting a woman's right to make her own choices regarding her health and well-being. within the context of her own lived experiences and her own personal, religious, cultural, and family beliefs. I hope that this recognition of my work as a WHNP in a variety of arenas over the past 35 years or so serves as an inspiration to those providing women's and gender-related care now and in the future. We have to continue to provide high quality, comprehensive, full scope sexual, reproductive, and other related care. And we have to advocate for the patients we care for and for the WHNP profession. Our work is at the very center of gender and reproductive justice and personal autonomy. I hope to continue my efforts towards socially just, equitable, and accessible sexual and reproductive health care for many years to come. Thank you very much for this award.